Understood. So there's a lot of buzz right now regarding a new movement in healthcare that Berkshire Hathaway, Amazon, jpmorgan Chase, their initiative to create and get involved with healthcare. Any thoughts at all?
Yeah, sure. They have. It's an interesting model. They haven't released really any model. We don't know what they're going to do.
Right.
So we're all speculating as to what they're going to do. They recently hired Dr. Atul Gawande, who is well-known surgeon in Boston and contributor to the New Yorker and well-known author on healthcare issues. And they recently hired him to run a company to take advantage of some of these opportunities. It's interesting on a couple of aspects. First, the three companies are starting with their own employees, their own covered population, not everybody. So right there, they've got kind of a built-in advantage in the sense that their own employees are probably going to be a little more educated than the average person off the street. They may be a little healthier, but still what they're looking at is huge increases in the costs, and they want to see greater efficiencies out of the system. It's going to be hard for them, I think, to make some of those savings come about, because it's difficult to make actual savings occur without rationing care. Let me be a little more specific about that. So right now there's also a lot of commentary on high and low value care and payers not paying for low value care. What is low value care? Low value care is something where there's little evidence that a particular treatment or therapy or pharmaceutical intervention does much good over a population. Maybe it has a small effect, but it doesn't have a whole lot of value, therapeutic value or long-term outcome value. So one of the things I've heard is that this group would minimize the amount that they would pay for low value care and only pay for high value care. If that's the case, that means that the employees of those three corporations will have to accept that kind of decision. They're going to have to face their employees and say, I'm sorry, we are not going to pay for that procedure or that drug or that therapy that your doctor told you to get. And because it's low value. And here's the evidence. Well, the evidence schmevidence. The people don't want to hear that. So you are once again in a position as a payer, and in this case the payer is the employer, of saying no. And when that happened last time in America, it was the managed care HMO company that said no. And it was a financial success because we drove down costs in this country, but it was a policy and political failure. People just didn't accept it. They wanted choice. They wanted their doctor to be in control. They wanted to make those decisions for themselves, not have a company, no matter how well researched that company is in terms of understanding what's high and low value. They don't want others to make that decision for them. So it'll be interesting to see how this works out.
Americans like choice.
They do. They do.
It's clear.
And I think in this country we've yet to come to grips with a fundamental dialectic, and that is that on the one hand we want healthcare to be a service, a public service that everybody can access. It's open to all, and that whatever you need, you would get. On the other hand, we have a very strong ethic in this country that it's a commercial service that's bought and sold on a marketplace. And we've not really come to grips with how those two aspects of healthcare really work off of each other. They're in fundamental conflict. So the free marketers feel that competition will drive down costs and improve efficiency and increase quality. And there are many, many, many cases in business where that is the case. And they point out the fact that in healthcare, all the regulation and all the unique aspects of the healthcare industry prevent that from happening. And on the other side, those who look at this and say it's a public service, it's a good for the public, they have a valid point too. And for that to be efficient and effective and equitable, it needs to be managed a lot more closely. So, we've not resolved that issue, and that has been the source of a lot of strains that the healthcare system has been under.